Good afternoon. I'm Steve Rehorst, the Public Information Officer with the Watertown Task Force. Thank you everyone for joining us today here at our briefing. Up first, we have Mayor Karen with our community update.
Good afternoon. Today is April 21st, 2020. In our state, we have a total of 1,755 COVID cases and 8 deaths. That's one new one in Minnehaha County. Cottington County has 13 cases, 12 of which have recovered. Last night, the City Council acted to move the expiration of Watertown's shutdown ordinance to next Monday night, April 27th. That's a month earlier than it would have expired naturally. There will be a special City Council meeting on that day, and the City Council will be considering whether to adopt a new ordinance, continue with the restrictions that we have right now, or just to fall back upon the governor's executive order. And so I wanted to talk about that a little bit. Council President Glenn Vilhauer will be here in just a few minutes, and he'll talk about it as well. But the executive order from the governor still applies in Watertown, even though we have our own ordinance, which is more restrictive. There's still some requirements in there that apply to all of Watertown, Cottington County, and the entire state. So I want to go through what those are. And the governor's executive order directs all South Dakotans to practice the CDC hygiene recommendations, know the symptoms of COVID-19, call before visiting a healthcare provider, stay home if you're sick, and take extra precautions. Remain home if you're vulnerable due to age or a health condition. And also to assist emergency, medical, and law enforcement professionals. All employers must implement the CDC hygiene practices and prepare to endure into August or beyond. They should also innovate or come up with new ways of doing things, encourage teleworking, limiting gatherings and travel. They should also consider doing health checks and screening. The enclosed facilities, including bars, restaurants, breweries, cafes, casinos, coffee shops, recreational or athletic facilities, health clubs, or entertainment venues, are directed to follow the CDC guidance when 10 or more people are in an enclosed area where separation of 6 feet is not possible. And they're directed to do business in a way that does not involve gathering a large group of people or 10 or more people. So like doing takeout, delivery, drive-through, curbside, and off-site service. And they're also directed to innovate. Her order also encourages everyone to spend time outside while following the CDC guidelines. And no matter what the City Council does, those orders will remain in force as a minimum. So if the council takes no action next week, then the governor's executive order will prevail. So I will appreciate your feedback about what you think the City Council should do, and I know that the City Council will appreciate it as well. So feel free to reach out to us, and I thank you for that. And now I would like to introduce Glenn Vilhauer, the City Council President. Glenn.
Thank you, Mayor. I'd like to, before there's been a lot of confusion as to what we did or didn't do as a council last night. So I'd like to clarify some of that. But before I get into what we did last night, I want to back us up a month as to action that we took back in a special council meeting back on March 23rd. We actually took two different pieces of action at that meeting. One was a resolution that declared a public health emergency for Watertown. That was probably the less significant or less contentious of the two actions that we took at that meeting. But anyway, that included a provision that we shut down all city-owned buildings. Well, it didn't occur to us at the time that included a number of different facilities around town that, yes, we own the building, but we did not operate the business going on in there. For example, the museum, the event center, the Boys and Girls Club, Senior Citizens Building, the Watertown Area Transit. We realized that we were shutting them down. I think in most cases, a lot of those places continue to operate, but we felt like we needed to take action on that. So last night, to remove that discrepancy, we took an action that now says that we're requiring closure of only city-operated buildings. So, for example, City Hall is a city-operated building, for example. So, just to clarify that, we loosened up the restrictions that those that were operating out of a city-owned building could continue to do so. It was only those where the city itself was operating out of a city building that would be required to be closed. The second item, which is probably again the most contentious and probably confusing, is the action that we took back on March 23rd, and this was by way of an ordinance that required closures of businesses around town. And that had, I won't go through the list of, I think people by and large know what was included in those closures: bars, restaurant, entertainment facilities, for example. And that provision, or that ordinance, had a 2-month a period whereby it would automatically sunset on May 23rd. But there's also a requirement that every council meeting that we take a look at that ordinance to see if we needed to amend it, repeal it, extend it, whatever the case may be. So last night we did that again. I just want to say I'm part of the Watertown Unified Command team that meets every day to discuss where we are with the COVID situation. I've got the utmost respect for the healthcare professionals of this community. We've got top-notch people that are monitoring this on a daily basis. By the same token, we're getting a lot of feedback as council members from business owners and citizens in general from the community that are wondering, hey, when can we look at doing something differently as far as loosening restrictions? So last night we discussed this at length at our council meeting, and the decision that we took last night was, rather than letting the ordinance extend out to May 23rd, that ordinance will sunset now next Monday night at midnight, or 11:59 p.m. Monday night on April 26th. So it's actually going to sunset considerably sooner than it was originally planned to. But the ordinance will sunset, but that does not mean that we won't do something differently. I highly suspect, like Mayor Karen alluded, that we will do something in the meantime then at that meeting next Monday night, at our special council meeting, replace that with some other sort of ordinance. I don't know what that's going to look like at this point. We want to gather feedback as members of the council from the Unified Command team. We want feedback from public. We want feedback from business owners, because we don't know what that ordinance may look like that we might pass next Monday night. If we don't do anything, which I suspect, we will do something more than likely, but if we don't do anything, then like Mayor Karen said, we will fall back on the governor's executive proclamation from a couple of weeks ago, which is currently less restrictive than our ordinance that we have in place. So that's why it's important for us to gather as much feedback as we can from the public in the meantime, as far as trying to decide what we want to propose next week at our special council meeting on Monday night. So if people think that because we're letting this ordinance expire, that things are going to open up and continue as always, no, that's not what we did last night. We only shortened up the period that this ordinance would be in place, and it will sunset now next Monday night, but then subject to whatever we then do as a council as far as replacing it with something else. So again, please reach out to us as council members, to the mayor, because we want to know what the sentiment is around the community, keeping in mind that we've got to be concerned about health care in the community, as well as the economic health of the community, because this is doing quite a number on our sales tax revenue, and that's what drives our city by and large as far as what we operate on, that we can't ignore that aspect of what we are going through as well. So please, we will get through this. Like the mayor has always said, it's painful for all of us involved in this, but it is something that we do want to do what's right for the community. So again, stay tuned because next Monday night we'll have another important council meeting to decide where we go from here. So with that, I would like to introduce Lisa Johnson, who is a local job service manager.
Good afternoon. Thank you, Glenn. My name is Lisa Johnson. I'm with our Department of Labor and Regulation here in Watertown. A lot of individuals have been waiting for this, so we have the Pandemic Unemployment Assistance available now on our website. Those are for individuals who are independent contractors, self-employed. They maybe own a business or they're a gig worker. They can go to our website, which is raclaims.sd.gov. And then you can file either online or by phone. After that, those individuals will need to upload proof of income because there isn't a way for us to do that. So individuals can upload one of the following: their 2019 federal tax return, the 2019 1099 miscellaneous income only, their 2019 W-2, a final pay stub in 2019. If you don't have any of these above, you could also provide a 2018 federal tax return. If you are unable to provide proof of the 2020 wages, you will only be allowed the minimum until you prove your earnings for 2019. And all of this is on our website as well. Some individuals may have already filed their claim, so please wait until you're denied, and then you can file a new claim for benefits under the PUA. If you are approved for the PUA, you may also receive that additional $600 as in the regular unemployment insurance claims. A person cannot do the PUA and the PPP, the Payroll Protection Act, at the same time. The other thing we want to remind individuals is that we're asking people to be considerate. We are processing an enormous amount of claims. You know, we're doing this as many as we've done in the last year. So please be considerate. We are doing our very best to process those claims. We are training existing staff to help process the claims. So that does take about a week, and that's what we've been doing. So another thing that's important to mention is individuals who have both full-time employment and part-time employment will not be eligible if their part-time employment is lost, because they're still fully employed at their full-time job. Also, please read all of the information that is sent to you. We do send a packet out in the mail. Utilize any resources that we have online to help as well. Also, reach out to your family and friends if you're not understanding, or give us a call. We have our local number, which is 882-5131, and we're there 8 to 5 weekdays. Or you can also go online, raclaims.sd.gov, 24/7, or you may also call 626-2452. Thank you.
Thank you, Mayor Karen, Glenn, and Lisa, for your information today. At this time, we'll open it up to the media if you have any questions. All right, if there are no questions from the media, we'll end the briefing here today. And tomorrow, we're going to do our best to be on at 3 p.m. and be back at that time tomorrow. So we'll see you then. Thank you.